Okay, so what we're going to do here is we're going to find the supraspinatus and check how it's feeling for you and start to treat it. So you have pain here? Okay. Very painful?
Not really painful.
It's not very painful, but you can feel it. Okay. So we're just going to do some deep friction massage on your supraspinatus. It's very deep and sometimes it requires dry needling to get at it very well because it's really deep inside the scapula, above the spine. And after it's here, after the muscle is here, its tendon comes along here and fixes to the rotator cuff. And so because it goes through that tunnel, it's actually devoid of the blood flow to heal it. That's why it takes so long to heal and why you've been suffering for a couple of years with this. And you feel quite good, but you know, the training isn't quite as good as it could be, which is a bit frustrating for you. You okay?
The pain is increasing.
Sorry?
There's more pain now. It's more pain.
Yeah, exactly. As I'm finding the exact spots where you've got the problem, it's a little bit more painful. But it's just a short, deep friction massage to make sure these muscles start to heal themselves. Okay, good. Okay, now we're going to come around to the side and look at infraspinatus. Okay, so now we're going to look at the infraspinatus muscle, which is below the spine of the scapula here. It's a big muscle, it covers most of the scapula, the whole blade, and usually there are some sore points in there. Is it sore?
Yes.
Yes? Worse than the other one?
No.
No, about the same. Okay, good. So we're going to work away at this little muscle. Now he's pretty tough, so I think I'm going to get my instrument that I often use on shoulders. Okay, so this is just an instrument that we sometimes use to get deep into the muscle. Okay? You can feel all the little... We can treat them with our fingers, we can use instruments like this, we can use dry needling, we can also use some other physical therapy modes like ultrasound and combination therapy. So we find all different ways of helping you with these persistent muscle problems of the shoulder which impede the movement really of your shoulder. And afterwards we'll check to see if you can feel a little bit less tension. Painful?
Yeah, at the bottom.
At the bottom here? Yeah. Yeah, I can feel it stopping me there. Okay, good.